Okay, so here we go with part 4. This is around something called impingement syndrome. Impingement syndrome. And it's a syndrome in the sense that it's there's a cluster of shoulder different diagnoses that fit within this syndrome. We're going to look at each one of those individually. We're going to look at it, but first I want to look at it broadly. They all have common characteristics in this sense before we kind of get into the particular. This is kind of confusing at times. Kind of our first run through with this. May not get it fully, but hopefully by the end you'll get more of a good sense of it, and then you can kind of follow up with questions and do the hands-on stuff to kind of pull it all together. So the shoulder impingement syndrome, the definition of this broad cluster of different shoulder diagnoses, how it connects with lost space and shoulder kinesiology. Okay, shoulder impingement syndrome. This is kind of a good graphic and shows you about it. Basically what it's about is this, keep thinking about space. Tight space within the shoulder capsule, all the shoulder anatomy. Any little dysfunction within all the different parts of the shoulder, the rotator cuff muscles in particular, causes problems. Posture causes problems, compromises the space, leads to pain. So let's just look at this on the left. There's the supraspinatus tendon. See how tight that little space is through there as it's rolling up for abduction and other motions. Again, this is where you commonly get torn. If somebody has a torn rotator cuff, usually what they mean is they've torn the supraspinatus. Usually where they've torn it is right where it connects to the bone. So usually when they're doing the surgery, they're going in, it's kind of torn or frayed, and then kind of stitch it back up or reattach it to this bone. Here's the bursa, right on top of the tendon, right underneath the acromion in that tight space, shoulder bursitis. What causes shoulder bursitis? Lack of space. Pushing up into the bursa causes it to irritate, to swell. As it swells, it gets bigger, takes up even more space. So it gets all swollen, this tendon gets all swollen, other tendons get all swollen. This kind of leads to this cascade of problems, all because of the tight space in there. Shoulder impingement syndrome basically is a cluster of shoulder issues that are related to tight space, misalignment, lack of balance within the muscles within that space. Using the kind of graphic of it, see that humeral head just banging and pushing up into the acromion, into the bursa, causing all kinds of problems and issues. That's why the posture is so important. That's why the overhead stuff, you're doing overhead stuff into that closed pack position, painters, drywallers, baseball pitchers really test and strain this whole area within the vulnerable area within the shoulder anatomy, leading to all these shoulder issues that we're going to talk about. This is kind of how it goes. Kinesiology is kind of how it happens. As you get weakness within the rotator cuff muscles, the humeral head, top of the humeral bone, has a superior anterior migration, reducing the space, causing pain. So when I say superior anterior, basically what I mean is up, forward and up. So if you visualize, take your fist as the humeral head and take your hand and cup it over the fist. Let's say that's the humeral head going into the fossa. And what's happening with this imbalance is the humeral head goes up into the fossa and forward. So it goes up into the fossa and forward, up and forward, basically pushing into that space, causing irritation. Shoulder pain, loss of motion is generally caused by the humeral head coming up and forward, superior and anterior migration, reducing space and flow, influenced by poor posture again, influenced by weak, torn rotator cuff muscles. To fight this, how do we fight this? This is what we're doing in treatment. This is how we're fighting it. We got to go the opposite way. We got to pull it down and back, more inferior and posterior. We got to open up that space so it can glide and do what it needs to do without causing pain and irritation. So we want inferior migration. We want to pull it down. And we'll literally do this when we do the joint mobs. The anterior deltoid primarily pushes the humeral head upward. If it's unopposed by the rotator cuff muscles, it's going to jam it up into the fossa and cause problems. The rotator cuff muscles push it down through that balance. That's why they're so important. Another one that really opens up the space, which is a great exercise, great movement within the humeral head, is shoulder extension, especially resisted shoulder extension. Pushes the humeral head down and back, just what we want. So that's a good exercise to think about, shoulder extension. Scapular depression also pushes the humeral head. So to fight subacromial impingement, progress toward resistive exercises that emphasize external rotation, scapular depression, resisted shoulder extension. Because external rotation, scapular depression, and shoulder extension open up the space. Posterior migration, pulling it down, opens up the space. Pectoralis major pushes the humeral head forward. The pec major, we'll talk about this. I think I did talk about this in the anatomy lecture narration. It looks great. It's a glamour muscle, but it's bad news for your shoulder because it's pushing it forward, jamming it into that fossa. You can lose range of motion. I had a student last year. He had great pecs. He just went for it every week and really worked out at the gym, but he could not get his shoulders above 110 degrees of shoulder flexion because he had compromised space because he had overdeveloped pectoralis major muscles. External rotators, infraspinatus, teres minor, if you listen to the anatomy lecture, push it back, open up the space, as do the rhomboids, because they get that scapula back. So, to fight that upward migration, forward migration, strengthen the external rotators and the rhomboids and the shoulder extensors. This is where your rehab is going to be. For all these shoulder syndromes that we're going to see, seems like a ton of stuff, all these shoulder things. How can I remember it all? It's all this cluster of the same, basically. You're doing similar things for all of them. Okay, so that is that one.